If you take even one prescription medication, the next few minutes could keep you out of the ER. Over 600,000 older adults visit the ER every year because of medication problems. Studies show many of those visits could have been prevented. Not all, but a lot. The same handful of mistakes keeps showing up, over and over again. Today we're walking through all 7 of those mistakes, clearly, one by one. This video is for education only. It is not a replacement for your doctor's advice. Always talk to your doctor before changing anything about your medications. Some of these mistakes feel so normal that most people never even suspect them. In fact, one mistake is something almost every senior does without thinking. We'll save that one for number 7. So stay with us all the way through. Mistake 1. Skipping doses or stopping a medication too early. Doctors see this very often, and it can lead to serious trouble fast. Studies link poor medication habits to many preventable hospital stays in older adults. Sometimes people stop because of side effects. That's completely understandable. Others stop because they feel better and think the medication has done its job. And for some, the cost gets too high, so they quietly ration their pills. Here's the problem. Your body needs a steady level of medicine to stay protected. When you skip doses, that level drops, and your protection drops with it. Blood pressure medicine stopped suddenly can cause a dangerous rebound spike. Stopping antibiotics early may let resistant bacteria survive and spread. Ask your doctor about the right course length. And skipping diabetes medicine can leave blood sugar dangerously out of control. Studies link missed doses to a higher hospital risk. The effect varies, but the pattern is real. Ask your doctor, what if I miss a dose? Can I ever safely stop this medication? Mistake 2. This one surprises a lot of people because it feels harmless. Some older adults skip doses or take less of their own medicine to save money. Studies show up to 1 in 4 Medicare patients ration their own prescriptions this way. Here is the problem. As you age, your kidneys and liver gradually slow down. They clear medicines more slowly, so drugs can build up in ways that surprise doctors. So the same pill that helps your friend could build up dangerously in your body. Blood thinners are especially dangerous. Too much can cause serious internal bleeding. Many heart pills need exact doses. Too much of some can dangerously drop blood pressure. And strong pain medicines, opioids, can be life-threatening at the wrong dose. Now, cost is real. We understand that. But there are safer answers. Ask your doctor or pharmacist, is there a generic version of my medication? Many drug companies also offer patient assistance programs that significantly lower costs. There is always a safer path than borrowing a prescription. Always. Mistake 3. And this one trips up even the most careful seniors. Most people assume that if a medicine is sold without a prescription, it must be completely safe. But safe on its own does not mean safe when mixed with your prescriptions. Studies show OTC drugs frequently help trigger dangerous interactions, especially painkillers like ibuprofen. Here is why. Over time, your liver and kidneys naturally lose some of their clearing power. Medicines leave your body more slowly. That means they build up more easily as you age. Take ibuprofen, a common pain reliever. Many seniors take it without a second thought. But if you take a blood thinner, adding ibuprofen can seriously raise your risk of bleeding. Another example? Antihistamines, the allergy or sleep medicines found in most medicine cabinets. Older allergy pills like Benadryl are linked to confusion and dizziness in older adults. Coming up at Mistake 5, we'll cover a supplement interaction that surprises even health-conscious seniors. For now, here is one simple habit that could protect you. Gather every OTC bottle you own. Bring them all to your next appointment. Vitamins included. Your doctor needs the full picture. Let's pause for a moment and look at how far we've come. We've already covered 3 of the 7 biggest medication mistakes seniors make. Mistake 1. Stopping or skipping a prescribed medication before your doctor says it's okay. Mistake 2. Taking a friend's or family member's prescription, even with good intentions. Mistake 3. Assuming over-the-counter products are always safe alongside your prescriptions. Those 3 mistakes alone send thousands of seniors to the emergency room every year. But knowing about them already puts you ahead of most people. We still have 4 more mistakes to go, and they are just as important. So let's keep going. Mistake 4 is one that can quietly cause harm at any time. It involves something almost every older adult overlooks: a simple list. Mistake 4. Not keeping a complete, up-to-date list of your medications. If you are over 65, you may take 5 or more medications every day. That many medications means the chance of errors goes up fast. Research shows the highest risk moments happen during care transitions. That means leaving the hospital, seeing a new specialist, or getting emergency care. Without a written list, doctors may accidentally duplicate a drug or miss one entirely. That kind of mix-up can send someone straight to the emergency room. The fix is simple: 1 small card, or a note on your phone. Write down each drug name, the dose, how often you take it, and why. Also write down which doctor prescribed each one. That detail matters greatly. Bring this list to every appointment. Your regular doctor, specialists, everyone. Yes, that includes your dentist and your eye doctor too. Every visit. One updated list, always with you, can prevent a very serious mistake. Now, mistake 5. And this is the one we promised was coming. Many seniors take supplements every day, thinking it's natural, so it's safe. But natural does not mean harmless, especially when you are on prescriptions. Some supplements can interact with prescriptions. The evidence varies. Some links are strong, some mixed. Garlic is strongly linked to bleeding risk with blood thinners. Fish oil evidence is mixed. Ginkgo may raise bleeding risk with blood thinners. Research is mixed, but caution is wise. St. John's wort is one of the most studied. Its interaction with certain medications is very well established. It can interfere with antidepressants and other important medications in serious ways. Some other supplement interactions are based on case reports, still worth knowing about. The key point: your doctor may not know what supplements you're taking unless you tell them. Ask this simple question: do any of my supplements interact with my prescriptions? Your pharmacist can often help right at the counter. Just ask when you're there. Natural or not, every supplement you take belongs on your medication list. Mistake 6. And this one hides in plain sight in almost every home. Most people store their medications in the bathroom. It feels natural. But the bathroom is actually one of the worst places for medications. Heat, moisture, and light all break down medications faster than you'd think. A drug that looks fine may have lost much of its strength already. The kitchen is another common spot, and just as risky as the bathroom. Research shows most oral medications do best in a cool, dry, dark place. A bedroom drawer or a dedicated hall cabinet works very well. Some medications need the fridge. Unopened insulin is the clearest example. Certain liquid antibiotics also need to stay cold after they're mixed. Patches and skin creams have their own rules. Always read the package. Expired medications often lose strength. Some liquid types can also become harmful. Ask your doctor or pharmacist: am I storing all my medications correctly? Mistake 7. And this is the one we promised would surprise you. You feel a new symptom. Your doctor prescribes another drug to treat it. That second drug causes another symptom. Then a third drug gets added. Doctors call this a prescribing cascade. One drug leading to another, then another. Doctors say this cycle happens often and is easy to miss. Here's a real example. Some blood pressure medications cause a dry, nagging cough. That cough gets treated as a new problem with yet another prescription. Cholesterol drugs cause muscle aches in many people, sometimes mistaken for something else. A new prescription may follow when reviewing the first drug was the real answer. The good news? Stopping this cycle takes just one simple question. Ask your doctor, could this new symptom be a side effect of something I'm already taking? You don't need to change anything. Just ask that one question at your next visit. That single question can break the cascade and possibly prevent your next ER visit. So let's quickly run through all 7 mistakes one more time. 1. Stopping a medication early. 2. Borrowing someone else's prescription. 3. Mixing OTC products with prescriptions. 4. No updated medication list. 5. Underestimating supplements. 6. Storing medications in the wrong place. 7. Mistaking a side effect for a brand new condition. None of these require special equipment or money, just awareness and one conversation. If this helped you, share it with someone over 60 who takes regular medication. Drop a comment below. Which of the 7 mistakes surprised you most? Subscribe for more evidence-based videos on healthy aging every single week. This video is for educational purposes only and is not medical advice. Always consult your doctor before making health decisions.